One benefit of bathing a patient is that it utilizes the therapeutic relationship to help patient in a time-sensitive approach. It can be done only with extensive training in therapeutic technique. It allows providers an in-depth exploration of patients' presenting problems. It assumes that ambivalence is a normal part of a change process. Which is not a basic principle of MI. Providers are obligated to inform each patient of the negative consequences of their behaviors. The patient is the expert of her behavior. Helping patients understand ambivalence to change is often more powerful than direct super instruction. People often continue behaviors with negative consequences for reasons unknown to the provider, which is not a basic principle of MI. Providers are obligated to inform each patient of negative consequences of their behaviors. The patient is the expert on or his behavior. Helping patients understand ambivalence for change is often more powerful than direct instructions. People often continue behaviors with negative consequences for reasons unknown to the provider. The BATE technique was developed more than 20 years ago and has been used extensively in primary care and family practice. The new positive BATE is stress, the patient's problems and concerns, personal accomplishments, thankfulness, autonomy, and general positive effect. The belief that one should only refer to practitioners who embrace the viewpoint of positive psychology. The belief that all things are possible through positive affirmations. What is the only drug for bulimia approved by the U.S. Food and Drug Administration? Citalopram, fluoxetine, imipramine, sertraline. The primary purpose of the positive BATE is intended to help patients by creating a stronger therapeutic alliance, helping the patient change negative behaviors, focusing on autonomy and accomplishment, engaging the patient during the psychosocial assessment. The criteria for diagnosing generalized anxiety disorder in the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, 5th edition, state that excessive worry or apprehension must be present more days than not for at least 1 month, 3 months, 12 months, 6 months. A patient is experiencing EPS side effects from his antipsychotic medications. Which approach to treating side effects would the clinician most likely take? Give the patient a drug holiday until the symptoms resolve and then restart the medication? Treat the patient with anticholinergics? Switch the patient to a different antipsychotics? Treat the patient with anticonvulsants? Drug treatment options for patients with bipolar disorder often include all of the following except atomoxetine, valproic acid, lithium carbonate, risperidone. Jamieson has been prescribed Celexa to treat his depression. Education regarding how quickly selective SSRI antidepressant work is. Appetite and concentration improve in the first 1 to 2 weeks. Full response to SSRI may take 2 to 4 months after he reaches the full therapeutic dose. His dysphoric mood will improve in 1 to 2 weeks. Sleep should improve almost immediately after starting citalopram. After a head injury, what is called when air enters into the cerebral spinal fluid spaces within the head? Raccoon sign, hemotympanum, pneumocephalus, bottle signs. Cerebrospinal fluid may leak through the cribriform plate region of the skull following a head injury and cause leakage of CSF from the mouth, ear CSF otorrhea, leakage of CSF from the eye, nasal CSF rhinorrhea. When prescribing a benzodiazepine, the advanced practice nurse should consider the onset of therapeutic effects takes many days. The ingestions of 3 to 4 days of therapeutic dose can be life-threatening. Concomitant use of alcohol should be avoided. The medication must be taken at the same hour every day. Benzo. Which of the following is the most consistent with diagnosis of dysthymia? 23-year-old man with 2-month episode depressed mood after a job loss. A 45-year-old woman with jitteriness and difficulty initiating sleep for the past 6 months. A 30-year-old woman with fatigue and anhedonia for the past 2 years. A 15-year-old boy with a school adjustment problem, weekend marijuana use for the past year. Dysthymia. Commonalities among psychotherapeutic techniques include psychodrama group psychotherapy and 12-step programs, obtaining external perspective and participation in helping relationship, dream therapy, listening and reflection, self-help groups. A patient presents to the clinician after experiencing 4 episodes in the last month of sweating, palpitation, chest pain, nausea, and shaking. Each episode lasted about 10 minutes. The patient is now becoming very fearful of future events and has been reluctant to leave the house. The clinician suspects panic disorder, but wants to rule out any possible medical causes. Which medical condition can mimic the symptoms of panic attack? Hyperthyroidism, cardiac arrhythmia, pheochromocytopenia. It is important to educate patients with depressions and their family members about reporting signs of increasing depression and suicidal thoughts. This is especially true during the time period when switching to a different medication, 1 to 2 weeks after the initiation of treatment, 1 to 2 weeks after tapering off medication before the initiation of treatment. When trazodone is used to aid sleep, the drug should be optimally taken long prior to sleep. 2 hours immediately, 15 minutes, 1 hour. Which type of burn injury results in destruction of epidermis with most of the dermis, yet the epidermal cells lining hair follicles and sweat glands remain intact? Superficial burns, deep partial thickness burns, superficial partial thickness burn, full thickness burn. Which of the type of burn results in destruction of epidermis with most of the dermis, yet the epidermis cells lining hair follicles and sweat glands remain intact? Which drug is likely to be the most dangerous when taken in overdose? A 2-week supply of nortriptyline, a 3-day supply of diazepam, a 4-week supply of fluoxetine, a 3-week supply of venlafaxine. Bathing the patient is an advanced practice nursing intervention that allows the practitioner to focus on the process and not the assessment, make the patient family happier, conduct psychological counseling within the context of the primary care encounter, develop a therapeutic relationship without owning the patient's problem.